Welcome all you Greenstein Dental followers out there, and to those of you who found this video by way of my latest book release entitled O3 It's Magic. If you haven't gotten a copy of it yet, please swing by the office and ask for one. You'll be real glad that you did. The purpose of this video is to be both instructional and educational. For me, it's always about having the cleanest and healthiest mouth possible. In my view, these two products and techniques you're about to witness are number 2 and 3 on the dental hit parade, right behind brushing. Today we're going to learn both the importance of and proper method of flossing your way to health. And in our next video, we're going to work on tongue cleaning, both of which have a hugely positive effect on your oral and overall health, stimulating your body toward a better version of itself. All right, floss. The one word that you wish you could avoid hearing at your hygiene visit, I'm sure. Those darn hygienists. They almost shame you into feeling inadequate for not flossing twice daily like everyone else on the planet, right? But to be fair, those hygienists have a tough job, and they do a fantastic job helping all of us. Well, I'm here to help give you the real scoop. And here's what I know. Most of you don't like flossing because you say what? It's a pain in the butt. And you thought I might say something else, right? I'm just trying to keep it G-rated. The other thing that I hear is it hurts and I bleed, and I don't want that. I hear you guys loud and clear. And here's the problem. Actually, a couple of them. First, what kind of floss do I use? Is it waxed, unwaxed, coated, flavored? Which one's best? Second, you've never been taught the right way to do it. I'm going to show you what I mean, and here's where we shift to PG rated. Let's get right into the demo, and then we'll finish off the subject of floss and answer most of your questions. I've asked Miss Dunya to join us today so that I can demonstrate in the mouth exactly what flossing is going to look like. The first thing that I want you to know is you need to get yourself about a foot and a half piece of floss, something long enough so that you can grab it properly. And here's the PG part. I want you guys to use the middle fingers. I know, I didn't shoot a bird at you, I promise. Here's what's important. Everyone uses these pointer fingers. The index fingers, they wrap the floss around and they start dancing around their mouth, and they cannot floss properly. When you use the middle finger, it makes it awfully easy to have 4 fingers available any way you need to manipulate it in your mouth. Let's take a look with Miss Dunya. How you doing today?
Good.
You ready for a great floss demo?
Yes.
Let's do it. I want you to come in and approach the front teeth here. You're going to slide through the contact, and once you get through there, wrap to one side, and you're going to slide up and down, a good 3, maybe 4 times. Come out just enough to pass by the pointy gum tissue so that you get to the other side, slide up and down, just enough, and then out. What you don't want to do is you don't want to come between the teeth and start going in and out, in and out, in and out, thinking that you're accomplishing something. Now, some of you are going to ask, my teeth are so tight, the floss, it shreds or it rips when I use it. Well, I've got an answer for you. So let's talk about products for just a moment. Oral-B makes a product called Glide that we use here in this office, been doing so for years. The reason is it's slightly waxed and quite thin and simply doesn't shred between teeth. Now, they make a floss and they also make a tape. You see what works best for you. I guarantee you for crowded teeth, you're going to enjoy using that product. Now, some others are going to ask me, what can I do underneath a bridge? You know, when I'm missing a tooth. Enter floss threaders. They're neat little devices. They look like a fishing line shaped in a loop, and it allows you to put the floss through it, much like thread in a sewing needle, only it's easier. You're going to get right underneath the bridge with a piece of floss, and you can swipe back and forth 2, 3, 4 times just to make sure no debris is caught underneath. Let me show you what I mean. We have a floss threader with floss already threaded into that little fishing loop, if you will. We'll come over to Miss Dunya again. You're going to place that right in between where the false tooth is. You'll pull the floss threader through and hang on to one piece of the floss, And now that you have the floss caught underneath the bridge, all you want to do is swipe gently back and forth, a good 2, 3, maybe 4 times. Just enough to dislodge the debris. And then pull the floss out. So, how frequent should I use floss? Well, for those of you that remember The Odd Couple, there's only one Felix Unger. But sure, after every snack or meal, even twice a day, what dental professional would have a problem with that? But listen, if you do this thing right, even 3 to 4 times per week, along with proper brushing, it'll make such an incredible difference in your overall and oral health, you simply have no idea. But you gotta do it. I didn't say 3 or 4 times a month, 3 or 4 times a week. Proper flossing, like we've shown, will disrupt the bacteria buildup in hard-to-reach areas that your toothbrush all too frequently misses, and it will prevent your gums from becoming inflamed and bleeding. Remember, inflammation is the beginning of trouble. It's your warning sign, flashing right in front of you, letting you know that something worse is waiting ahead if you don't eliminate it. If you find yourself bleeding just a bit, give it 2 or 3 days and you'll notice a reduction. Another way to enhance this process is if you dip your floss into either a fluoride rinse or an antimicrobial rinse like Paradex, PerioGuard, Closis, or Oracare. They're all excellent products that can be found on our product list on the site. Depending on your individual needs, we can assist you, whether trying to reduce inflammation or strengthen the enamel surface to avoid decay. To sum it all up on floss, unless there's room for something much larger, like a toothpick or a go-between, a proxy brush, you know, those little bristle brushes that sometimes fit between your teeth, or even using a water pick, there's simply nothing better than floss to get under the gums in those hard-to-reach places, as long as you're doing it right. Give this method a try, and most importantly, remember the concept that you achieve the goal of disrupting plaque, whether it's with the string, alone, or on a device that you might have picked up at the market or pharmacy. Happy flossing, y'all.